Hello, my name is Umphlett, and I am currently a residential senior here at Liberty University. I am a public health preclinical major, and I have just applied to PA school this past summer. I have a minor in biology, and I'm working on a minor in psychology. And so for today, I'm going to be focusing my research on the quantifiable measures and that contribute to success to becoming a PA and also getting through PA program. That is just also being the best prediction for academic success in the PA program too. So I guess as a question, it would be, what is the quantifiable factors that best predict academic success in a clinical preparedness among students entering physician assistant programs? And so I have two articles that are going to help me out that are from our module 2. And the first one is Psychosocial Approach to Sports Injury. BA states, I'm going to state a couple quotes from them and just portray what I learned from that. Sports injuries are not solely a physical problem, but a complex phenomenon influenced by psychological and social factors. That's from Bay. From that first article, the psychosocial model provides a comprehensive framework that integrates physical, psychological, and social components of injury. So with this, it's talking about mental health and how mental health can contribute to injuries in sports. And as a PA, I would be really looking at this for diagnosing and treating. It's a uprising and more occurring determinant of health that people aren't really looking at. So just being aware of that and using that to help diagnose and treat patients is going to be huge. It's not really looked at either, so it would be a great way to, I guess, break down how they're feeling and help them in the future from that. So another quote from Bay highlights that psychosocial variables play a central role in both injury occurrence and recovery. So that is going to be huge for me as a PA because I need to make sure that I'm giving my treatments quality, or my patients quality treatment, which would be further and preventative measures. So getting to the bottom of what's going on in their head is going to impact how they play sports in the future. Another article that I used is the Biopsychosocial Approach to Sports Injury, but a systematic review and exploration of knowledge structure. So this specifically, this article is looking at multiple social determinants of health, which can be sleep, it can be your social environment, it can be your feelings, anxiety, different mental health issues, and it can be also the specific place that you're in or what you're doing. So it being in the workforce, it could be you on the field, it could be you off the field, it could be in a classroom setting. A couple quotes that I gathered from this would be a physical recovery, mental detachment from a sport, and high quality sleep were significant predictors of both injury risk and mental energy. So if you're not getting the quality sleep, you're not going to be functioning cognitively, and this is going to impact so many different areas of your life, from mental to social to on the field, and it could even be a chronic illness too. So another quote from Bulk is, our findings show that recovery-related behaviors have quantifiable effects on the injury occurrence. So basically these behaviors have been quantitatively analyzed, and it's been proven that if you do not take care of these social determinants, you're going to have negative effects. This kind of goes in my research method. I'm really looking at using correlational quantitative analysis, and it's mainly because I'm gonna actually take a quote from our publication manual, but it says tables communicate qualitative data are effective only when the data are arranged and their meaning is obvious at a glance. And so this is really supportive of using this because as a PA, there are many different factors that will contribute to you being a successful PA and getting into PA school. So this is a huge strength for me because I'm able to look at a large scope of data and quantify it and then explain it. So this supports the decision of choosing quantified study to the previous PA students' data and then the certified PAs too. So Creswell states correlational research study designs provide an opportunity for research to predict their scores and explain relationships among variables. These scores would be predicted in clinical hours, GPA, volunteer hours, and even like evaluations and rotations in PA school. And then lastly, we have stressed the importance of providing a rationale for information displays in tables and figures in the manuscript. This is from Crawford too, from our in-source text. So specifically with this, I kind of already discussed it, but we can be looking at clinical hours, evaluations, GPAs, and rotational performance. And I'm gonna use a couple quotes from Creswell, which is another article that I wanted to include in this. Quantitative procedures allow researchers to generalize results from a sample population to a specific degree of confidence. This just is using a lot of different factors, and all of these would be more accurate because you're looking at the sum of everything, and you're going to be looking at a lot of different participants, which would be like the PAs, and using all of that data within it is going to be super accurate. This is just creates that consistency, that reliability, and then with this, they're all numerical data, so that validity would be super involved also. Creswell also states quantitative research also fails to capture the context or setting in which individuals talk or act. So some of these anxieties or feelings and social, that qualitative stuff is not going to be reflected, so that's going to be a weakness. This would be oral or written forms that would be hard to communicate or interpret through a quantitative visual aid, which is from Crawford, from our in-text course. So I just wanted to make sure I included that a little bit. And so those wouldn't be specifically displayed through the hours that are being put in. Sometimes you can reflect a total number of hours, however you actually getting that clinical or that hands-on experience. So that's where that can be a little misleading. This goes into our reliability and validity. I'm going to define both of them through our in-text source, which is from Creswell. Reliability in quantitative research is achieved by consistent scores across administrations of a test through clearly defined instruments. So that would be like using those different PAN scores through the PA schools, or the rotational evaluations and how well they did. And that would just be across the board of so many different tests that they have within PA school, but then among a lot of different PAs. So that's going to be super accurate for results. Validity refers to the degree in which evidence and theory support the interpretations of a test, ensuring that inferences made from a quantitative data are sound. So some way that we can observe that validity would be like those recorded like exams, and how well they did on those exams. That would give the quality of how much they learned within their clinical hours, within those rotations that they've been to, their clinical year, where they go in and they actually get that hands-on critical experience. Or when you're applying to PA school, when you have that EMT, you go into an interview, you have to make sure that you're reflecting that too. So that's the validity, the accuracy of it. Sometimes that can't be as well quantified though. So some of those strengths and weaknesses are going to have to be really like involved and just used within our study. And some of those threats can be supported by these quotes. Validity refers to the degree which evidence and theory support interpretations of test scores, ensuring that inferences are made for quantitative data are sound, like I said before. Although we typically may think of communication in terms of oral and written forms, you may also need to communicate and interpret quantitative visual aids accurately. Threats internal validity arise when factors other than treatment influence outcomes and challenging interpretation of quantitative results. So what are those things that are driving those results? These are all from Creswell and Crawford. So with our data collection, I just want to be prompt with this, but we're going to be using numerical graphs. We're going to apply all of those different scores, their PANT, their GPA, the clinical shadowing hours, every single thing that would allow me to get into PA school. I'm going to compare that against a lot of different applicants. And then another part that I would do with this is take the PA students who are in PA school and allow them to reflect their PANCE, their rotation scores. And that would reflect how well they were doing and what they had done beforehand as a pre-PA and then as a PA student. So I think that would be really cool. I can use a survey too, which would help with that qualitative and the emotional or behavioral factor. This would be quantifying the ratings of burnout or stress, sleep hours. Even going back to the beginning where we talked about how mental health plays a huge role in your cognitive function. So those type of things are going to be measured in the survey. The issue with this would be not having enough access to the clinical schools, irregularity with some of the responses in the survey. This could even be some people not even completing the survey, so that would be something that I would really have to just look at, especially for that validity, and then inability to quantify some of those psychological factors. That would be from the survey too, but even just volunteering, are they actually getting that amount of experience that's leading to those PANCE results in those evaluations? So I would approach this analysis by a process in several ways. I would use tables and graphs to show correlations and the results of the PANCE scores and evaluations. These are all numerically divided up, and they would be compared across that graph or the pie chart. I could either use a percentage, or I could just use the number of hours and then compare that to their GPA and their PANCE scores. End result, the overall goal is to extract the most influence or impactful routes of becoming a PA. By using this correlational and quantitative study, I'm able to do that across the board because of all of the numerical data that I've been given. I can better answer what quantifiable factors best predict academic success, clinical preparedness among physician assistant programs, and pre-PA students. The challenges I would encounter would be the inconsistent results of that qualitative data, and then that would be coming from the survey, and then also a lack of representation from the different hours that I'd be quantifying too. So thank you so much for listening. I hope you have a great day, great finals week, and thank you. Bye.